Hey everyone, it's Parker with Dailey Aesthetics and Hormone Clinic here. I'm here with one of my patients, Brian Wilson, who is doing his second Morpheus8 treatment out of the series of 3. I thought it would be very beneficial to kind of hear what it was like with his experience so everyone is a little bit more comfortable with doing it. So Brian, tell me, what made you want to do Morpheus8 microneedling? What were the results you were wanting to look for?
Well, I think as I get older and get more wrinkles around my eyes and so around like lower lips and
Right.
lowest jaw area.
So just wanting to go a little bit more refreshed, kind of getting rid of fine lines and wrinkles, maybe like skin texture, kind of stuff like that. Okay. So I know that pain control can kind of be a huge thing with Morpheus8. That's kind of the things that you hear online. So I know that we did the topical agent on you. How did the topical agent feel? Was it burning? How good do you think it did with pain control?
I think it worked for me real well, except on the thin skin layers. Sometimes it can get just a little sticky, but I didn't have any problems.
Yeah. And that's actually what I'm hearing from a lot of patients with the Morpheus8 is that over the bony prominences of the face, specifically like the forehead and around like the orbital rim, it can get a little bit spicy. So we'll actually be using a different kind of topical lidocaine cream with you today. It's going to be a combination of a couple of things, but it has phenylephrine in it, so it can actually really help drive that lidocaine into the skin, as well as we'll be doing nerve blocks today. We'll kind of have a medial nerve block. Okay, and then during the treatment, what would you describe the feeling? What would it feel like to you during the middle of the treatment?
Didn't really notice much. You could feel the procedure being performed, but I think it was worth.
Yeah. And then what about post-procedure care? How red were you? Were you swollen? How long did the swelling last?
So the next day I was pretty swollen under my eyes where the thin skin is, but by the next day, most of the redness had resolved.
Oh, good. And let's see here. Did you have like any peeling? Did you have any bleeding? Were you having to take like medications afterwards because it was just not tolerable?
I didn't take any medicines. I didn't have any bleeding. My skin felt like it dried out just a little bit about a week afterward, but that was really about it.
Yeah. All right. And you're here for your second treatment. So I guess you were happy enough with the first results, right?
Right.
Alrighty, guys. Well, we will cut and I will get to put some topical numbing agent on him. We'll do some walkthrough about what is the benefit of doing topical cream and kind of other pain control stuff that we can do for the Morpheus8 so it can be more comfortable for you. All right, so I got my patient in the correct position, kind of leaning back, and I'm at the head of the bed here. So what I'm going to do first, Brian, is I'm going to clean you off with some Puricin, just making sure that we have the skin clean before we put the topical lidocaine on, okay? All right, now that we have the patient all cleaned off, we are going to use some topical lidocaine cream. This is actually lidocaine tetracaine phenylephrine. It's a 23.71%. And it is kind of in a lipid kind of profile, which actually makes it kind of adhere to the skin a little bit more. So after we do this, then we'll put some occlusive dressings over it. So then it kind of keeps into the skin a little bit better. Alrighty, and that is it for the topical lidocaine. So what we're going to do is we're going to put an occlusive dressing over this, and then we will wait 45 minutes. So we'll see you guys in 45 minutes. All right, it's been 45 minutes. I've already taken the occlusive dressing off, so now we're just going to clean him off again with the Puricin wipe. We want to make sure that we're getting all of this lidocaine off, because sometimes if we don't get it off, we can actually cause little white blebs to be in the skin, and that's just because the microneedling is pushing that lidocaine down into the skin, which if it happens, nothing bad, it just is not appealing. All right, and we are going to do a nerve block. Okay, and so I have a combination of lidocaine with epinephrine and then also just a little bit of bicarb in there to help kind of take some of the sting out. But what we want to do is kind of right around the orbital rim, there is a little indention, and literally mid-pupillary line, kind of just above the eyebrow is where some of the nerve endings come out. So we go straight down to the bone. We develop a large wheal of lidocaine, and it will numb the middle portion of the patient's face. All right, ready, Brian? Pinch and burn. Pressure, pressure, pressure. He has large wheels, but we want that. We want to flood that whole area with lidocaine. That way, when it disperses, everyone's anatomy is different. These are just kind of where we kind of aim for. But when you put a large wheel of lidocaine in that, it will diffuse. So we actually are going to cover what we are needing. So with the Morpheus8, we have several hand pieces. We have the face. We can do 24 pins. It can also do 12 pins, which is kind of resurfacing agent. So we'll be doing both of those. But then this one is for the body, and it has about 42 pins on it, so it covers a lot more surface area. But what we're going to do, Brian, I'm going to start off on a very low energy with this, and then we kind of take it a few minutes at a time to see if we can increase the energy on that, okay? All right, so right now, 24 pins, 5 energy with a depth of 2 millimeters. We're going to do fixed. So the needles come out and they pop twice, giving energy, the radio frequency twice. That way you don't have to actually go back over it a second time. You've actually already hit that area twice. I'm going to do a test one here. Ready? How was that?
Fine.
Good. All right, so that was a good pass for the top of the head. And then we're going to hit it again with a 1 millimeter, and then we will do a resurfacing aid. So how has that been so far?
Fine.
Pretty good. Where would you say the most spicy parts were? Your cheekbones? Yeah. So I increased the depth to 4 millimeter because since we want a little bit sharper jawline, you can actually go a little bit deeper. And the thing with Morpheus8 is you can actually cause a little bit fat melting. So it's very important that you want to not have any fat melting in the mid-face region. But if you want a more sharper jawline, you can definitely do it up under the jawline. And we're about halfway there. We have 521 pulses. So a good pulse for the face is around 1,000, so we are well on our way there. Alrighty, so we've got 1 and 2 millimeters done, and all we need to do is just do resurfacing agent after this, and then we'll actually be good. Alrighty, I have the resurfacing agent here. So basically this is very, very, very small. It goes up to like 0.5 millimeters within the skin. So it just kind of gets the top dermal layer. This is really going to help with pigmentation, also going to help with skin tone as well. So just kind of nice icing on the cake. Also, we'll be treating down here on his neck where he actually has some sun damage, and the resurfacing agent can actually help some with that sun damage. I think that's about it.